Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning for another segment. We'll be speaking with Dr. Darrell Gray in this segment. He's joining us here as Chief Health Equity Officer at Elevance Health. He's going to talk about how and why health equity should be automatically embedded and reflected across all lines of companies' business so that everyone in the healthcare ecosystem benefits, especially the patients and their families. Welcome to Health Professional Radio. Dr. Darrell Gray, thank you for joining us.
Thank you so much, Neil. It's a pleasure to be here.
A bit of your professional background briefly, if you would, and then let's talk about what health equity is and why it's important, especially for a company like Elevance Health.
Thanks so much. So, Neil, I currently get to serve as Chief Health Equity Officer at Elevance Health, but prior to joining Elevance, I trained as a physician. So I am a board-certified gastroenterologist, also a public health practitioner. I spent most of my career in academic medicine and also conducting NIH-funded research. But core to who I am is being in the community in community outreach and engagement. And so that was core of the work that I did prior to joining Elevance Health in August of 2021. So I'm really excited about what we've done as an organization, what we continue to do, and what the future looks like. So thanks for asking, Neil.
What is health equity and why is it important?
Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And look, any organization that has employees is a health company because your employees are your greatest asset. And we know that their health translates to productivity of that organization. We also know that health across populations is not the same. And so as we look at the opportunity to elevate health for all, we understand that there's some populations that need resources in a different way than other populations do. And so that's what distinguishes health equity from equality. Equality as a process says that, Neil, I give you the same resources that I may need, knowing that, Neil, we may have different family dynamics, we have different backgrounds, different needs, different living situations. And so health equity says, we're going to meet you at the point of your need, Neil. We're going to meet you at the point of your need, Darrell, to ensure that you can have the optimal health outcome possible. And so for us at Elevance Health, we have a bold purpose of improving the health of humanity. And we believe that requires us to elevate whole health. And when I say whole health, Neil, I'm talking about health, yes, certainly what happens in the clinical walls, the clinics, the hospitals, emergency departments, but more broadly, what happens in homes, in neighborhoods to address behavioral health, to address social health. And we're also in a unique position to meet the pharmacy needs of those whom we serve. But it's also critical to advance health beyond just the traditional health care. And in doing so, advancing health equity as well.
As far as Elevance Health's approach to health equity, do you consider it basically in support of what we've been hearing so much about in the last few years, precision medicine?
Well, I think one of the key words that you mentioned was precision. I think for us, it's certainly a very personalized approach. And at Elevance Health, our approach, we call it health equity by design because health equity is the bedrock of all that we do. And so embedding those principles in our practices, our programs, our products, and our policies we see as critical. And we fundamentally believe that health equity is not a product or a separate vertical of business. It's really in our organizational DNA, Neil. And it's everyone's business, as I commonly say at Elevance Health. It's really at the core of us delivering on our strategic priorities, which include exceptional consumer experiences, digital platform for health, care, provider enablement, and like I mentioned earlier, whole health. And that's what makes our approach distinctive. And we're already seeing manifestations of this as far as us delivering on our commitments that we've made, for example, in the World Economic Forum Zero Health Gaps Pledge, or in relationships that we've brought to bear among our associates to better enable us to deliver on our commitments, such as in our working relationship with Harvard T.H. Chan School of Public Health. But also people will notice in how the care is being delivered both to our members, but their families and in their communities as well. And I think steps that we've taken, such as our National Committee for Quality Assurance, or NCQA, health equity accreditation, as I think about our kind of Medicaid, all of our own Medicaid plans have gone through this, which is, 93% of our Medicaid membership, over 8 million members are in an NCQA Health Equity accredited plan, I mean, I think we are taking steps in the right direction there.
Are there other programs that Elevance has developed to further this goal of health equity? And talk about some of the challenges that Elevance has overcome to that end.
Yeah, it's, I could talk for a long time, and I know we only have a few minutes together, but, we've certainly seen, as we have, again, tried to embed this in all that we do as an organization across all of our lines of business, how we are crafting, for example, our preference center, where we get to build better relationships through this preference center, better relationships with our members, our consumers, so that they have a more seamless experience through their healthcare journey. And part of that is what we do with relationship building, getting to know our members better in a more personal way to proactively identify needs and address through personalized solutions. I think also what we do with technology, whether it's digital solutions or even things like artificial intelligence. Neil, that our AI has gotten so much headlines recently, and we actually have an Office of Responsible Artificial Intelligence, whereby we can try to proactively mitigate any risk for bias and algorithms. And if we identify any bias and algorithms, we can mitigate that as well. So we've taken steps there. I think about what we're doing with our provider partners, because we know that our healthcare providers are a critical component of our members' health journey. And so the more that we do to partner with them, such as in education, we have a homegrown website called mydiversepatients.com, where health professionals can go in there and get free continuing medical education credit, regardless of whether that provider is in our network or not. It covers a wealth of topics, and this is something that we are continually adding to each year. And I also think, one thing that's really critical to our members, we hear day in and day out that our members want to find providers who they feel can identify with them better, a provider who they can have a solid relationship with, because we too believe that it's through relationships that our members can have better outcomes. And so as I think about what we're doing with our provider network, how we're making transparent providers' competencies and other demographic information like language, et cetera, race as an example, we hope to establish more impactful relationships between providers and our members. So those are just a few of the many things that are happening across our enterprise.
Is there anything that you'd like to add for our listeners?
Well, I'll tell you, it'll be reflected in our consumer, our member experience, both with us and with the healthcare providers, and the outcomes with improvements in our members' whole health and that of their families. So as we think about metrics, it's everything from what people might think of seeing their primary care provider to completing necessary screenings, whether it be cancer screenings or for example, diabetes follow-up. There's such an array of metrics that we follow, but it's important that we take that in the context of whole health. So social health and well-being, behavioral health, and meeting the pharmacy needs of those whom we get to serve. And we're seeing improvements in real time right now, Neil, as reflected in many stories and testimonials we get from families on a daily basis. But there's certainly more to do. I don't want to paint the picture that we are a perfect organization. We are not. But we're striving to be better every day, and I'm incredibly excited for the results we'll see over the next 3 years or so, Neil.
Great. Give us a website where listeners can learn more.
Well, please visit our website at www.elevancehealth.com. That's spelled ELEVANCE. Health is spelled HEALTH.com.
Great. Darrell, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio.
It's been my pleasure. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Darrell Gray. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.